We offer the AqueCool system to every one of my patients. There's a big difference between frozen peas and ice bags and the AqueCool, because it really does conform better. And the frozen peas and the ice, they're almost too cold at first, and then when it melts, then it's not cold enough, and it doesn't stay really well conformed. And it's a pain in the tush for the patient to have these Ziploc baggies that may get a hole in them, and now they get water all over them and all over the bed and so on. I just find that compliance is so much better with the patients that use the AqueCool, because it's staying on all the time and it feels so comfortable to them. They don't get up as much, so compliance is just so much better with that than it is the frozen peas. When you use the AqueCool system, it really does decrease the inflammation and decreases the inflammatory response. So not only does it make it better as far as the pain relief and any discomfort, but it also speeds the healing, because it cuts down on the histiocytes and the fibroblasts that are part of the early inflammation. So if you don't have that, if you look at those wounds that somebody has 2-3 weeks down the road, they're going to be much better because they've been using a cooling system like the AqueCool than what they would if they didn't. Because we're using the AqueCool system, you do get not only faster healing, but you get a better scar, because you are keeping out the inflammatory response. So if you're the zone of injury, from burns, we know that if you have a little bit of a burn, and certainly the fractionated CO2 is a little bit of a burn, you will get quicker regeneration of the skin using cool therapy and AqueCool. It just decreases the inflammatory response altogether, so that if you were ever worried about an area having a problem, that maybe the burn was too deep or that you might get hypopigmentation, certainly putting the AqueCool on that minimizes that quite a bit, because it decreases the tissue needs, so that the metabolism isn't going so fast, and so you don't increase the zone of injury as much. So honestly, it's a safer way to treat patients as well. Well, plastic surgeons certainly pride themselves on handling tissues very gingerly, and one of my professors used to say, you be good to the tissues, they'll be good to you. But part of being good to the tissues is also post-operatively. It's not just what you do in the operating room, it's what you do afterwards as well. And cutting down on inflammation, cutting down on, or increasing the compliance of the patient to keep it on, and to minimize the inflammatory response. All of those things go towards making for a better outcome. It's not just what you do in the operating room, but how somebody heals. The old saying, God heals, the surgeon just sends the bill. So you can do the surgery, but then they've still got to heal it. And so if you give them tools in which to decrease the inflammation and decrease the zone of injury, you're going to get a better result. When it comes to paying for the AqueCool system, patients that don't know the difference really do, they worry about the money. When we put it on them in the recovery room, we've had a number of times where we put it on them in recovery just for their early part of their recovery, and then they say they didn't plan on having it. We've had at least 8 or 10 times where people say, hey, I'll pay whatever it is for that thing, because it's so much more comfortable, and it just takes my pain away, and it conforms so nicely. I want to use that. In plastic surgery, I can bring the science and I can bring everything to it, but if the girls that work for me don't really 100% believe in it, it isn't going to work. And I've done a number of Active FX treatments on the girls that work for me, and they are 100% sold on the AqueCool system. So much so they didn't believe in it at all before we started doing it, and the rep let us demo one of the AqueCools for one of them, and after that, man, they just said, we got to have one of these, and then we got to have two of these. We're selling it like hotcakes because they believe in it, because they tried it.
My name is Annie Hembrough, and I'm a physician assistant, and I work with Dr. Daniel Mills here in Laguna Beach. I actually see quite a few of his patients. We work together on his surgical patients, as well as seeing patients on my own in various treatments using lasers and things like fillers and Botox. The Lumenis Active FX is a fractionated CO2 laser, which we use for patients to improve upon their fine lines and wrinkles and some of the sun damage that they can accumulate over the years. When doing the Active FX, patients will experience quite a bit of swelling and redness, and most of that swelling takes place in the first 72 hours. And so for that reason, we need to use something that is going to help with that, because the swelling and the redness is what patients complain most about as far as the discomfort goes. The more swelling they have, generally the more pain that they have. With doing the lasers such as the Active FX, we have started using the AqueCool mask to help reduce the discomfort that people have after the treatment. When people put ice on their face, they can only do it for certain periods of time. It starts to melt, it gives off some condensation, patients get frustrated with it, they're always having to refill it. So for us, having a device that we can put on their skin and they can fall asleep with it on there and not worry about it falling off has really improved upon their discomfort after the procedure. Initially, patients, when we introduce the idea of using the AqueCool system, their initial concern is cost, and do I really need it? And I try to explain to patients how they're going to feel after the procedure, but as you know, it's always difficult to project what's going to happen in the future or how you're truly going to feel. So if we can overcome that, patients are so happy that they did it. Quite a few patients, before we start the procedure and I talk about using the AqueCool, they say, oh no, I don't want to use it. But the minute we're done with the procedure, that's when they're then asking me for it. So it almost sells itself. After doing something like the Active FX and your face feels like it's burning, this product really does sell itself. And patients, once they feel that discomfort, cost is no longer an issue. They want something that's going to give them immediate relief. And once you put that on and the cool water starts flowing through it and they feel that, right away they have instant relief. So it really is truly a miracle for them. Our office has had great results using the AqueCool, and in my opinion, going back to ice would just be taking a step back. So for us, we really push the AqueCool. I've had patients that use it, some that don't, and after doing a treatment such as the Active FX, the people that do not use the AqueCool, when they come in to see me 24 hours later, their face is twice the size it should be. And so patients who use the AqueCool, because they have it on 24 hours, and when they're sleeping, it's still on and they're still getting the benefit, they come in with just minimal swelling. So we've just been very happy with the results. I'm a skeptic, as with any new product that we get, and we see new products every day. People are always coming in with new things for us to use, and it's the best product out there. And I'm very resistant to try anything. But when we first used it, we just fell in love with it because patients were able to use it with no problem. And I feel if I can do it, then I can certainly get my patients to use it, and they have expressed to me how easy it was. The noise level for products is always an issue for patients, and this machine is very quiet, so patients are able to sleep with it, and it's very comfortable. So for me, that's been the greatest benefit. So in my opinion, it's just been a complete win for our practice.